Gauteng Health MEC Nomantu Nkomo-Ralehoko has vowed to shut down non-compliant spaza shops. The MEC has led a food safety inspection blitz in Ekurhuleni on the Gauteng East Rand. Now, the initiative comes amid escalating incidents of food-borne illnesses due to food products that were bought from local spaza shops. Let's now welcome the Gauteng Health MEC Nomantu Nkomo-Ralehoko. MEC, thank you so much for joining us. Good afternoon. So let's first understand the scope as well as mandate of your department in enforcing compliance by these spaza shop owners.
Good afternoon to you too, and good afternoon to the viewers at home. Indeed, we have a mandate as a Department of Health, but not working alone, working with the local municipalities and working with the Department of Economic Development, again working with the Department of Agriculture. So all these practitioners are there, including the police when we were even there in Ekurhuleni. This is one of the issues of foodborne illness that we believe that it's a societal issue. It requires all stakeholders on the board. And there are compliance issues, as you have indicated, indeed, that various entities of government we need to address by enforcing bylaws at the municipal level and environmental health laws at our level, because that's where I get in terms of the health laws, which it gives me that mandate of doing that. So communities, again, before we can even do that, there are processes that we must do of making sure that we educate them and we make them aware of these problems, and we make them aware again that they must ensure that they are not exposed to issues that our children in particular environments that will cause them harm. And we have seen quite a number of incidents that have happened because our kids have consumed food that have been bought in some of the questionable places in the province. And we have our visits, which we have been doing, by the way, is to go to the townships, informal settlements, in the hostels. We have been sending this message, but at no stage that now we've been tougher in terms of acting. So now we've decided that let those that are supposed to act do that part. And indeed, today we've done it at Arapak in Ekurhuleni by closing some of the spaza shops that we realized that they are selling some of the things that are not right to the community.
MEC, we're going to talk further about the current regulation of these spaza shops, but there seems to be a huge misunderstanding, and I think you made reference to it, as to who really should take charge of these compliance issues. As we understand, it's the municipality's duty to issue those trading permits, right? So in terms of enforcing those bylaws, then they need to do more. So help us dissect this confusion and also maybe just then enlighten the public as you go in this awareness campaign about where they can also actually report those that they suspect of not being compliant.
We're clear where we find out your spaza shop, it's in an illegal land. Ekurhuleni local municipality or Johannesburg or any other municipality must take full responsibility of ensuring that they are part of that. So the bylaws are done by the municipality. Hence, even when we are there, the person that must issue the penalty is the municipality. But the Department of Health must identify what is it that they are picking up there in terms of the compliance on the health side, on the health laws. Is this what you are selling bought in a proper place? Where did you bought it? Where is the label? What are the ingredients? What are in those ingredients? Are they not killing our own people, those ingredients that are there? Some don't have the label. Some they have the date. You remember the expiry date that we always talk about. It's no longer there. So those are the things that the department must do. Hence, we are saying the municipality can't work alone because they have to work hand in hand with the Department of Health, with the Department of Economic Development, which is the consumer affairs in the Department of Economic Development. On my side is the environmental unit that is responsible for health. We have a unit that is called Health Environment. That's purely their role is to ensure that they check the food that are being sold in any of our areas, whether it's a spaza shop or it's a supermarket, because it's not only about the spaza shops, these issues of compliance that must be done. It must be done in every area that is selling that. But again, the specific things that before we can even give you a municipality can allow you to trade in a spaza shop. That's the area where you are trading in. The building, is it conducive? Starting from outside and getting inside the building. who is the owner, because in most cases, remember, if it's a spaza shop, they operate in a place where there is an owner. And then are you sharing the responsibility with the owner in terms of managing the spaza shop? So those are the things that we are doing when we get there and do the checkup. So each one have a bite of what they're supposed to do. But we can't work in silos. We have to consolidate that work. And I think we did it during COVID-19, because I remember we had teams that were visiting each and every area in the province. The ones that are responsible for health, they will check the dented cans and eggs, if there are eggs there, or suppliers, what is the physical address of the suppliers, and the municipality will immediately do the compliance notices that will be issued and give them the deadline sometime. Because I was saying even today to the team, when you arrive, when you see something wrong, make sure that you issue the compliance certificate. You give them 7 days to do that. But because if you just warn them and not leave anything, when you come back, you can't just come back and shut them down. Have you made awareness program on that? Because I was telling them that those are the things that you must follow. Proper processes that are properly regulated, so that we are not being seen attacking our own people that are there. Because even the person, even if it's an illegal person, definitely the person that they are renting to somebody, and that person will feel that now you are cutting bread that is coming every month on the table from them because of the non-compliance issues that you are raising.
MEC, I know there's been quite a lot of debate about whether or not foreign nationals should, in the first place, be able to operate these spaza shops as per our constitution. But let's talk about the current regulation. Is it enough? And are you currently, looking at other means to ensure that you enforce compliance by anybody who owns a spaza shop?
For me, I will agree with you that it's not enough. We have to look further than what we're doing now, because again, even on the compliance side that we're checking, I realized that even on the shelves now, they're selling some of the medication that they're not supposed to sell as a spaza shop. So you can see that again, the role of the Department of Health, especially on the supply side of medicine. But we have SAPRA that must go and do those checks now when they go with us. The other area is the Department of Home Affairs that we work with them, by the way. They are always part of that, so that they can check, are you the legit person, in fact, who is a South African that is supposed to trade amongst us. So those are the other things that we're checking. So it's bigger than anything else now, but I think it's one way of opening our eyes that we need to integrate this work, national, province, and local municipalities. So the 3 spheres of government must work together. But our role as the province is that awareness that we must drive on local health promotion on my side, and on the consumer affairs on the Department of Economic Development and other departments, including those that issue the certificates. If the certificate have expired, when the person can renew that. So those are all the other things that we must do with the municipality and the 2 spheres of government, which is national and the province.
All right. A very quick one, MEC. I think crucial to this discussion, is what kind of penalties are there for those who are found to be non-compliant? We understand you've actually shut down some of these shops that were non-compliant, but surely harsher punishment, more than just fines, as well as temporary closure, is what will actually drive the point across and force operators to comply very quickly.
Temporary closure until you do the right thing that you have been told, renovate your building so that it complies with what the municipality wants you to do. That's what we have told them even today. We've even told them the offices where they must go. We've even attached the officials that must work with them so that they can take them through these processes, so that we're not being seen harsh. I fully agree with you, because you can't come and be harsh on me if you're not taking me through the road and the route that I must go to make things that to ensure that things are being corrected. On the illegal land, municipality must take full responsibility. What do they do when a person is there sitting on an illegal land and have a spaza shop now that is trading? They will definitely look into that as the municipality, which the MMC for Economic Development was part of my visit to those spaza shops. So she is aware. The team was there. They've taken the details. They will monitor and they will look for around now in the municipality, because it's their own land that this spaza shop have been built. So those are the things that we will definitely look into them too.
MEC, thank you so much for your contribution this afternoon. That was Gauteng MEC for Health, Nomantu Nkomo-Ralehoko.